Hey friends, I'm Dr. Susie Gronski, Doctor of Physical Therapy, pelvic health therapist, and sex counselor. A Patreon member recently asked me to talk about something that can feel pretty uncomfortable to bring up: spontaneous ejaculation during pelvic floor therapy. So let's unpack what's going on, why it happens, and how we as pelvic health therapists approach this with compassion and professionalism. Spontaneous ejaculation, or an unexpected erection during a pelvic floor session, doesn't mean someone is aroused or into it. This is a physiological reflex, not necessarily an erotic, psychological, or emotional response. The erection and ejaculation reflexes are housed within the spinal cord, specifically the hypogastric nerves that are connected to thoracic spinal levels T11 and T12. These nerves carry sensory sympathetic signals involved in ejaculation, the shoot part of the reflex. The parasympathetic input from the pelvic nerves S2, 3, and 4 via the pudendal nerve is responsible for erection, the point part of the reflex. When the perineum or internal pelvic floor muscles are stimulated, like during a digital exam, treatment, or internal manual therapy, these nerve pathways can be activated. For some folks, especially those who are already upregulated or feeling nervous, this could trigger a reflexive response. And this happens even though there's no erotic thought or feeling attached. That's called arousal non-concordance, when the body's physical response doesn't match what someone's mentally or emotionally feeling on the inside. It's common and it's not shameful. Bodies do body things sometimes, and what it's wired to do. The dorsal nerve of the penis or clitoris is a branch of the pudendal nerve. It's predominantly sensory but also has motor components. It runs underneath the sits bones and joins the dorsal vein at the top of the penis and travels along, ending in the glans of the head of the penis. This nerve relays sensory information to the brain, playing a key role in both peeing and ejaculation. Its stimulation, along with the other perineal nerves, even in a non-sexual context, can lead to an unintentional genital reflex. Muscles like the bulbospongiosus and the ischocavernosus, along with the external urethral sphincter, are motor controlled by the same nerve pathways. These structures and their neural control can be hypersensitive or have altered feedback loops, which again can create unintentional responses during therapy. So, how do we as pelvic health therapists respond to spontaneous ejaculation during a therapy session? First, we talk about these possibilities before any exam or internal treatment begins. We normalize it. This isn't about shame, it's about setting expectations and making sure folks know that their bodies might respond in ways that surprise them and that it's okay. If a spontaneous erection or ejaculation happens, we give space. We step out of the room to let the person regroup, and we always check in about comfort and consent. No one is judged, and we're not making assumptions about what it means. That said, it's important to understand that pelvic floor therapy is medical treatment. It's not a space for sexual gratification or erotic engagement. While some pelvic therapists, myself included, have additional training in sexuality counseling, any discussions around sex, arousal, and intimacy are held in a professional therapeutic context. There's no hands-on sexual practices happening in these sessions. For folks looking to explore arousal, erotic embodiment, or intimacy through experiential touch, there are professionals like surrogate partners and somatic sex educators who are specifically trained for that kind of work. Therapy is part of a broader care network, and depending on someone's goals, we can help point them toward the appropriate resources. So bottom line, our job as pelvic health therapists is to support the whole person, nervous system, and pelvic floor, and all through a science-informed, compassionate care without judgment. If you want exclusive access to my complete go-to tailbone pain treatment sequence, including a live model demonstration of how to use a pelvic wand to release pesky, tender pelvic floor muscles, come join me on Patreon. You'll get a full step-by-step guidance, plus tons of other uncensored pelvic health tutorials you won't find here on YouTube. Check out the link below.